Welcome back to Midday Kentucky, everyone. Well, there are many ways you can go about achieving the perfect smile you have always wanted. Today, we're discussing dental implants, and there's a lot of confusion out there. So let's get down to it with Dr. Gina Johnson-Higgins. How are you, my friend?
I am doing great.
My teeth are still feeling nice and clean after I saw you.
Wonderful.
I love it.
Wonderful.
Okay, explain to everyone at home, just so they understand to begin with, what are dental implants? Because people think also dentures are implants as well. So let's break those things down.
Okay, so dental implants are titanium bodies that go into your bone and take the place of the tooth root.
I got
so
you.
it's a substructure. Then there are different pieces that can go on top to create different needs.
Okay.
If you're missing all your teeth, if you're missing one tooth, if you're missing 2 or 3 teeth, there are different ways to put teeth on top of dental implants.
Oh, okay, on top of.
Yes.
I'm just going to call for the before and after picture that you actually worked on, if we can bring that up. And we want to show people, talk us through the issues of this patient to begin with and what it is that you actually did.
Our patient came in with a history of poor hygiene and poor care, and all of her upper teeth were unrestorable. There wasn't really any amount of money that was going to fix those the way they were. So for her, we salvaged the bottom teeth. We had a series of 6 implants placed in the upper bone.
Right.
Then in porcelain, we designed 3 separate pieces, side, side, and front, to replace all of her teeth.
Okay.
Why do it in 3 pieces? Why not do one big piece? Well, if you do it all together and something goes wrong, it's all gone.
Is that what you were calling, can I ask you this question? Because back in the day, the baby boomers would call that a bridge.
Yes.
Is that still the terminology to be using?
A bridge has an end and teeth in the middle. So tooth in the middle. That can be on real teeth.
Okay.
That can be on implants.
Yep.
It's still it's an implant supported bridge.
All right.
So that patient had a bridge, and a bridge on implants.
Okay. And is that a different pricing structure than it would be for doing each individual tooth?
Absolutely.
Oh, really?
Absolutely.
And that's for major cases, what you just showed us.
Yes. That
irreparable teeth.
That is when everything has gone wrong and you have no desire to have a denture. A denture is a different step.
Okay. Now let's just say I have one tooth that needs to be replaced. We're going to bring up a picture and show that, because it can show you how it can still look so natural.
Yes. This patient had a cyst in her maxilla between her upper teeth, and one of her front teeth was lost to a cyst. It wasn't cancer, it was just a growth.
Yep.
When the one tooth was lost, she could have had a removable denture for one tooth.
Yep.
She could have had a bridge where we cut down a tooth and they held a tooth between them, but she chose to have an implant, and we were able to restore that implant to look exactly like her other teeth.
It's amazing.
And difficult, and that can be a little more expensive than some of the other options.
Very quickly, now we know some insurance plans also cover this. This is something that you do with a full diagnosis when they come in to see you.
Yes.
How does that part work? Is you contacting the insurance companies or are the patients?
Typically, we take your insurance, we research your benefits, and we give you the best estimate and predetermination of what they're going to cover. Anything that the insurance companies tell you is not always a promise, but you get the best information that you can. Medical insurance is a little more of a certainty.
Right.
Dental is more like a discount plan.
So investigate.
Yes,
That's what we need to
yes.
do, investigate.
And to do that investigation, there are certain sets of terminology that you
Yeah.
need that you have to have a complete diagnosis
Well,
with.
you told me, because I asked you, because I
Yes.
do need to have an implant
Yes.
done. And I said, well, what am I covered by and how do I go about it? You gave me the examples. You told me
Yes.
what the insurance people said. You then said I need to go and see this specialist. Like
Yes.
there was a plan. And one thing I
Absolutely.
did like about when I had my first consultation with you is you did a consultation plan for the next 12 months.
Yes.
That's the important part.
Yes, it is a comprehensive view. It doesn't mean everything happens for you immediately.
Yeah.
But it does mean you know the truth about your teeth because you are in charge.
Yeah.
I can give you suggestions, I can help you maintain your teeth, but you have to choose to do the things that are best
You're
suited
right.
to you.
And you want to enjoy that steak, everyone over there at Malone's or Tony's. So you need good
Absolutely.
teeth to be able to get into it.
Yes.
Okay, Dr. Gina Johnson-Higgins, thank you so much. There's all the information up on the screen now. Give them a call. Everyone's there waiting for you to buzz them as well. Website and email address. Hey everyone, up next, Mark Zuckerberg faces Congress today to answer for Facebook's misuse of user information. Plus, Samuel L. Jackson, I should say, speaks on the impact of the film Black Panther. Stay tuned, everyone, for What's Poppin'.